This is Brainstem with your host, neuroscientist Dr. Hilary Marusak, production by Amanpreet and Manmeet Bogle. All right, Vara, thank you so much for joining us. I was very excited to meet you a couple months ago, and you have such a powerful story, so I'm very excited to get your message out. I know it's not easy to talk about your experiences with PTSD symptoms and also your experiences with cancer, but I don't think we hear enough from kids and from teenagers about what it's actually like in their own shoes, so I really appreciate having your perspective. So let's start at the beginning. Just walk us through a little bit about yourself. Tell us about yourself, your family, growing up, when you were diagnosed, things like that. Let's get into it.
Okay. Hi. I'm Vara. I am a 2-time cancer survivor. I had Wilms tumor both times, once in my right kidney, which is now removed. And then those cells continue to travel up to my lung, and I'm now currently like 3 to 4 years out of remission or something like that.
Awesome.
So that's pretty cool. I was born in Charlotte, North Carolina, and I live now in Ann Arbor, Michigan. I'm currently doing this from my school. I'm a 9th grader. So I got my treatment done at U of M Hospital, the Children's Hospital.
Mm-hmm. Awesome. And walk us through that whole process. Like, when did you, the diagnosis, did you start showing symptoms before that? How did you come to that point?
So in March of 2016, it's March. In March of 2016, I just had watched a movie. I went to the movie theater and I came back and I had shown signs of blood in my urine. And obviously at like 9 years old, you're going to be like, what? That's crazy. Because that's terrifying for a child to see that and be like, oh my God, like this isn't normal, obviously, because you're old enough to comprehend that's not normal and like know something's wrong, but you're also too young to understand like what it could be. Right. So being one of the smarter decisions, I told my mom, obviously, and I was like, hey, this isn't normal, whatever. So we thought I had like a UTI or something like that. So we went to and we had just moved here. So we didn't have like doctors set up or anything like that quite yet, or we'd just gotten it. So I go to like a clinic that's like more near my house than like my regular like pediatric doctor. Mm-hmm. And so we go there and they like do like a urine sample or whatever. And and we go there and they're like, hey, we want you to go see this person at IHA, which is the hospital, I call it my regular doctor, and like where everybody goes. And I went there, and my doctor, my pediatrician, he was talking to me about it, and he was like, it's probably nothing serious. This happens all the time. This was on a Tuesday. Happens all the time, nothing serious. And I asked him, is this going to be cancer? Because immediately I was like, because, and he says, absolutely not, no way. So then they're like, just to make sure, we wanted you to go get an ultrasound of your kidney. I've also never had an ultrasound before because I was a perfectly healthy kid before all this happened.
Yeah.
And so we go there, and I'm just sitting there, and I'm nervous because they have to draw my blood and like get all this stuff done. And they weren't very the lady I had wasn't very nice about me drawing my blood. She was like, sit down, it's not that bad. I'm like, but I'm 9. So, so they do my scan and then we go and we wait, and it's probably Thursday or something. Yeah, it's Thursday. And I was like playing in the backyard with my mom, and I just gotten it was like nearish summertime, so it was a little warmer, and I got a popsicle, whatever. And then we get a call in the car, which is connected. My mom's phone is connected to Bluetooth, and it's something similar to like, I don't actually remember this part because I don't think I was listening, but it was my mom said it was something like, there's a tumor on her kidney or something like that. And I didn't hear it. So of course I wasn't freaked out or anything like that.
Right.
So then my mom like immediately like unplugs her phone and goes inside, and then I'm waiting, and then all of a sudden it's been a bit of time since I had seen her, so I go in to check what she's doing and what she like, how is it going, and she's sobbing, like, I mean, crying her eyes out. And I'd never seen my mom cry at this point before. I think once before we moved, but I think that's it. So obviously I'm like, oh my God, there's something wrong. So I all of a sudden was just like, what's happening? What's going on? So she comes out and she tells me that I might have to go to the hospital for a few days because they had found a tumor on my right kidney. Wow. And then I was like, a couple of days, having to do that for a couple of days, like all this kind of stuff, because I was so nervous that I just freaked out, obviously. I mean, no one's going to take this lightly, not even adults. And
no, it's the C word. Anyone hearing the C word.
Expect a child to do the same then. So I did the whole thing where I had like they gave me like a wet rag in my hand to like cool me down because I was like freaking out. Yeah. And so all of a sudden she's telling me about it. She was like, you're going to have to do this or not. So then I throw the towel on the ground and I say, I'm going to do this. I said it like I had a choice, but like, I like to think that I had a choice, but like in retrospect, I probably didn't. But, you know, whatever it takes to get a person's
a 9-year-old through.
Yeah. I was like, I'm going to do it. And then my like slogan for my cancer journey was she believed she could, so she did.
Love it.
So, and that's where that came from. So obviously, okay. So fast forward, we go into the hospital. I don't really remember a lot of this part because it was super foggy. I like know the process of going into surgery. They had me like drink the thing, and then they put me under, and then I got my kidney taken out. And then the first thing I remember when I was waking up is them like lifting me onto a bed and like putting me into a hospital bed. And I wake up and like all of the hospital stuff is so foggy. Like I ended up staying there for 12 days because I got chemo while I was there, I believe.
Okay.
Some of this might be like a little wrong.
A little jumbled.
It happened at some point, but a little wrong because I don't remember all of it, obviously. But so I get lifted in, and at one point someone's like, you have Wilms tumor or whatever. And they were like, because they thought at first it was like this other kidney cancer that I don't know, that's more common in older for this, I guess, like older people who get cancer, but it wasn't. But my cancer is more common in boys under the age of 5, and I was a 9-year-old girl, so they were like, oh no. So they take me, and then someone at some point tells me, you have cancer, obviously, probably in a nicer way, hopefully. But another thing I remember while I was in the hospital was this guy going to my mom and saying, sign this if she dies, sign this if she dies, sign this if she dies. Just saying it, because like he's reading off like a textbook or something like that.
Right.
So then my mom took him out into the hallway and was like, if you ever do that again, like I swear. And I was like, So then that happened. So then I went home, and I remember seeing my house, like we just moved in, but it was like they'd like moved a bed into the back room of my house for me, and then like had gotten a new couch and like and then my house actually the day I came back was starting to get an add-on to it. So there's like loud noises and like construction all around my house while I'm just like, throwing up in a bed.
So you got surgery and then immediately chemo after, and then
I think
what other treatments?
Yeah, I got my kidney out, and then I got my treatment, and then I went to I went back to my house. Obviously not immediately after, because that would be insane, but like watching my levels and stuff, and then they sent me home.
Right.
Because, you know, I got an organ removed, so they want to make sure that like works.
Yeah. Oh my gosh. Yeah. And your mom's reaction, like I can only imagine, you know, what a parent would feel like. So I think that's one of the biggest things to know is that like this kind of thing is really a family disease, you know, cancer or any other chronic illness like this. Can you talk a little bit about what the most stressful parts of this were for you in your mind?
I mean, when I was little, like I didn't think, you don't think about death when you're younger, like, because you're so young that you're not going to think about it. So I think I was in an interview with this one, like I was doing some work with this like one like organization, I guess you could call them, I don't know. And he asked me in the interview, have I ever thought about dying? Which, like, okay, sure, maybe you want to know that, but you don't ask a kid that.
Right.
And like, I mean, a lot of stressful stuff was just like, at some point I knew what was happening. Like I knew what I was going to feel like after what I got and stuff like that. So I think the anticipation of just getting the stuff was the most nervous part. But a lot of the time I was on so many nausea meds that I couldn't be nervous. Like I just was not relaxed. I didn't feel good, but I wasn't like thinking about everything because I was basically just there. I couldn't think about anything because I just didn't work.
Right. And like you're saying you were nervous, like anticipating a port being accessed or like getting your blood drawn or not knowing.
I had to face a fear of needles.
Oh, jeez.
Right before this happened, probably in February, I got my ears pierced when I was 9. And that's not because my mom was like, you have to wait. No, I just didn't want to do it because that's terrifying. But now I have like 2 and a nose piercing. So you can see how that went. So I had to overcome a fear of needles. I don't really remember I don't remember a point where it was like, oh, I'm not scared anymore. At one point, it's just kind of like, oh, well. I mean, there's a lot of stuff like you encounter bad nurses or people. And like when I was getting my port access, the dressing they used over it made blisters on my skin. So I had to use the paper kind. But like really just like getting your port changed isn't super fun because you're just kind of sitting there like, this is, you're like chest exposed, just kind of like, this hurts a lot.
Right. And talk about the fear of the, confronting this diagnosis and that it is a life-threatening diagnosis. And, a lot of kids, when they get cancer, leukemia is the most common type of pediatric cancer. So a lot of kids are so little that they might not remember some of these experiences and they might not know what, fear, like confronting death means. And for you at 9, like you said, you're old enough to know what's happening and what the magnitude of that C word is. So talk about that.
I like facing it. I just faced it head on because I didn't know what else to do. And it's not like there was really a thing where I could have been like, I don't want to do this. And then they obviously like told me the consequences of that if I got that done, if I didn't get stuff done. So then I was like, no, I kind of want to live. So I just went into it and they told me I was going to be fine, which I obviously am right now, but they told me I was going to be fine. So I was like, okay, I'll just do it then. So I did it. And then of course it happened again. And then that's a whole different thing because then people go into like, well, you knew it was coming, so it's easier.
Right. So talk about some of the symptoms you've been experiencing since. So this happened for the first time in 2016. So it's been a while and it's not uncommon to have these kind of lingering symptoms. This is actually really common. So what have you kind of noticed in yourself?
I remember I was watching a class documentary and in the documentary, they started playing, like, somehow in the documentary, they were in a hospital, and then I heard an IV machine go off. And this is in 7th grade, so it had been a bit, and I had already gone through my second one, too. So I heard it beep, and I go to turn around to turn it off, like it was right behind me, but I was in my school. And I wasn't terrified, but I was so confused because I was like, what? Because I went to silence it and it just wasn't there. But I just like all of a sudden, and no one noticed. Of course, it kind of looked like I was either like cracking my back or something, but I went to like go turn something off. It wasn't there. And that was pretty crazy. I mean, when COVID started, that was a really interesting experience. I learned a lot about my reaction to medical things because all of a sudden my teacher like when COVID started, he just like shows us a video and he's like, you guys need to know what's going on in the real world. Okay. And shows us a video of like people dying of COVID, people getting covered in hospitals, whatever. I hyperventilate and I have to go and no one, because like my school is so small and they know my story and they know what gets me upset, like certain smells or whatever. So they're showing me people dying of an illness. So I'm going, obviously, and we had no idea what COVID was or how it worked, or I mean, I didn't at least. But I go to like, I'm like shaking, crying, like full on like a panic attack in like the hallway of one of my like classes. And like then like we had a learning specialist who would hang out with me sometimes, and she was talking to me like, what happened, like what was going on, and I was just like, I can't look at that. That doesn't work with me. Like I can't. Obviously, you have to face it at some point, but like I can't. I need to be warned or something like that when something like that's going to be shown, because that is really triggering. And a lot of the thing is like people don't consider kids with cancer, like people who have like cancer, they don't consider that like trauma or that is traumatic or whatever. Like I had someone tell me, oh, you don't have PTSD, you just have PTS. And I was like,
meaning post-traumatic stress symptoms rather than the disorder.
So I was just kind of like, I mean, just because I wasn't like in the military doesn't mean that I don't have certain things that like really like freak me out or whatever. Yeah. Like one time there was a smell in my classroom and it was some like disinfectant or something like that. It smelled exactly like the stuff they would use at the hospital. And I literally had to go home because I just was like, I can't do it. And a lot of people were like, well, it's just a smell. Like it doesn't, like, that's not real. And like, you just convince yourself, or they're like, just forget about it. And I'm like, right. Thanks, guys. I really appreciate it.
Yeah, and that's why I think your message is so powerful, because it is a common misconception that a life-threatening disease or confronting some sort of medical trauma, that is a trauma, like you said. And we think of the classic veterans or car accident victims, but, you know, we're going to hear from a child psychiatrist soon. But one of the, you know, to be defined as a trauma, you have to have some sort of threat to life or threat to kind of personal or your bodily integrity, as we say in more of the psychiatric field. But cancer would absolutely qualify as that. And you hit on another great point, which is that you can still have symptoms. You might not have enough symptoms to just tip over into that diagnosis, but you can still have symptoms of post-traumatic stress, and they can be very distressing for people. Yeah. And you hit on so many of the classical symptoms, as you mentioned, like hearing things that remind you of something that happened, like hearing that IV beep or smelling something that reminds you. And you might not even know that because, you know, a lot of this can be processed kind of below the level of consciousness, but your brain knows that because it sure remembers what happened to you. So what other like things have you experienced? Have you had any like flashbacks or nightmares or anything?
Nightmares are like not as common anymore. But like, yeah, you get fears of like, I'm sick, or like say that like if I get a pain in my like kidney somewhere, or like if I like just like feel my stomach move a little bit or something like that, I get all freaked out because I'm like, oh, I'm sick again. Like immediately I'm just like, I'm sick again. I don't want to go back. And like, I mean, I have to go to scans every 6 months still. So like that's never fun, but it's not like a triggering experience. It's more of like a just kind of like, oh, this is like weird because I was here when I was like 9 and then 11, and then you're kind of just in a whole loop of craziness. But no, I don't like, I have like, the thing is with flashbacks, it doesn't look like how it looks in the movies. It's not like you see it. you know, like you're not like seeing it, you know what I mean? But like all of a sudden I'm just like, why am I getting this feeling about this one thing? And then it brings up so many memories so quickly that it just like kind of like goes onto your back and you're like, oh my God, like I don't want to experience this ever again.
Right. And you said you had a panic attack. Can you describe what you were feeling? Like, could you feel your heart racing?
Yeah, so I suffer with anxiety already on top of all this. Like I had it before and stuff like that. So panic attacks aren't new for me, but like I don't think people understand who like obviously have never had a panic attack how sudden it happens. With panic attacks, I could be sitting like this one moment, and then the next moment I could just be like, like just breathing and like I don't know what's going on. I have no idea like what's happening. Like my legs can get numb and stuff like that. Like I just can't. I don't know because it almost feels like you're so confused about what's going on because you can't pinpoint what is making you this nervous so quickly, and then all of a sudden you're just like, I can't stop breathing. Like I can't like control my breathing.
Yeah, I think one of the best things I'm hoping this episode will do is just shedding light on this issue and that, you know, we need to expand our view of trauma to include these medical things.
Yeah.
And I love what you said about how you were talking about how you have to continue to go see, you know, your doctor, and you have to continue to get check-ins to make sure that things are okay and there's no recurrence. And that level of anxiety doesn't go away after treatment ends. So it's like we run this race and there's a finish line and it doesn't end there.
Yeah. Another thing, I guess like another like flashback I had is so when I finished cancer the first time, 9 months after that, I got sick again. So when I hit my 9-month mark the second time, it was one of the most nerve-wracking experiences of my life because I was just like, if this happens again, I don't know what I'm going to do. Like I immediately was like, if this happens again, there is no way I'm going to make it through. Like I immediately was going to those places. I'm fine. I've been fine for like 3 years now. But like immediately, because every time I get farther and farther away, every time I'm like, if I got sick again, this would be this much worse. This would be like 6 months worse or a year worse or 3 years worse. Because you think I'm all the way better. Like my immune system's caught up. I have hair down to my shoulders. My skin's healthy. My blood levels aren't low. My platelets aren't low. All this kind of stuff. And then all of a sudden, that all goes away. With one diagnosis. And I think also another thing is a lot of people focus on the physical part of cancer because you have the bald head and the really sunken or a really poofy face, or a lot of things I'm just like, I don't actually care anymore about the physical part. I couldn't care less about that because that's not what I look like and how I feel and whatever. But when people are just like, oh, so you're done, so you're okay. And then I'm like, no, I'm not like okay. Like I just went through like a life-threatening illness and you're trying to make it look like I just didn't do that. And it can feel really invalidating because then you're like, well, am I making this up? Was it really that bad? And obviously, like, you've had cancer. Like, of course it was that bad. But, like, I sometimes forget that I did. So, like, I'll watch a commercial or I'll hear someone talk about it. I'll be like, oh, my God, that sounds like it really sucks. And then be like, oh, wait, I had it. So, yeah.
I love what you said about a lot of people focus on the physical aspects and they don't think about more the psychological aspects. What other misconceptions do you see that you'd really like to, you know, our audience to know and to break them?
When I got diagnosed, a lot of people that I was friends with stopped being friends with me and basically treated me like I had already died. And like all this kind of stuff. Because they're like, I've had people be like, I didn't really want to confront it because it was so scary. I'm like, yeah, it was. And I was just there. I had to do it. You don't have to do it. Like, I'm just sitting there just like, oh, well, like, you know, I don't understand.
So you want people to be supportive throughout the whole process, including afterwards.
Yeah, because, I mean, you don't have to, like, avidly check on them as much, but just be like, hey, how are you doing? Or whatever. But
checking in with you more, yeah.
And then when I get older, and I notice this more frequently as I'm in, like, a bigger school with more people, you tell people you get sick, and since they're high school students and they don't realize the severity of what that means or
Right.
how that goes, their first reaction is to make jokes about it. So
Okay. Yeah.
I've had people like, okay, so like my father's not really in the picture, right? So I don't have like, my dad just wasn't really there when I was sick. So people are like, your cancer visited more than your dad did. And then I'm like, that's so funny.
Yeah.
So what? Or they're like, third time's a charm. That's a really good one. Because then I'm just kind of like, okay, guys, see, this is the thing. I can make jokes about it because that's how I'm coping with it. Healthy or not, that's just what happened. But like, if you're going to continue to make jokes about it, you need to realize that like, that's not funny. Like,
right.
That's serious. Like, what if I did get sick again? Like, what would you do?
Mm-hmm.
You'd feel awful. Like,
yeah, well, teenagers, right?
Yeah.
So I wanted to end with what would you recommend for other kids who are having these types of symptoms? It could be related to cancer, related to other, medical diagnoses, but it could also be related to things like abuse. You mentioned it's really hard for you because not a lot of kids have experienced cancer that are in your social circle. So how do you find community? What do you suggest for other kids who might be struggling?
A lot of, well, I don't know if this is the answer you might want, but I don't actually.
There's no right or wrong answer.
I don't talk to a lot of people who are sick anymore because I saw so many people die that I knew that I just was kind of like, I don't want to see any more of this. That sounds selfish in itself, but I'm like, that was me, but like not. And I don't want to see my friends die. I don't want to know people that I know eventually are going to die, whether I can control it or not.
Right.
And like, I think also sometimes separating yourself from that community is as helpful as being a part of one. Because I know that I started to feel a lot better when I stopped. Also, like, I think like a lot of times, like there was a person at my school recently who had gotten diagnosed with something similar to leukemia. And immediately people were like, oh, token cancer kid, I know you had cancer. So let me tell you about this person's cancer that you know nothing about because it's always different. And like, even if they had the same kind as me, it's still more different than you could imagine because not the same reactions, maybe not the same chemo, not the same hospital doctor. Like it all depends on who you have, where you go. Like they will treat it all differently. And I think when people started treating me like I knew everything and I know everything, and when I couldn't answer questions, they'd be like, oh, I thought you should be able to understand this. I'm like, I'm not a med student. I have a few years of medical experience, but not in the way you think. Like I was focused on myself and how I was doing, not on how like, had they found a new type of cancer or like studying like how it works. Cause I was living it. I didn't need to do that. And I don't need to continue to do so.
I love what you said too about finding your own community. And it doesn't necessarily need to be, another group that's going through the same things that you are. I think you're spot on. You need to protect yourself and figure out what works best for you. So.
Yeah. And I think if finding that community means finding people who have gone through the same thing as you, that's great. Yeah. That's awesome that you can find people like that.
Absolutely. Well, Vara, it is the middle of your school day, so I can't keep you any longer, but I really appreciate you taking the time to talk with us and sharing your story. And you have a lot of great messages, so thank you for spreading the word.
Yeah. Thanks for having me.
Thank you. All right, Ryan, thank you so much for joining us from snowy Wisconsin. I'm trying to peek out your window there. We've got some snow in Michigan, so um, I'm really excited to have you on. I feel like it's been a long time coming, and just start by briefly introducing yourself for us, if you could.
Yeah, well, thanks, Taylor. It's great to be here. So, yes, hi, everyone. I'm Ryan Herringa. I'm a pediatric psychiatrist and associate professor of psychiatry at the University of Wisconsin, Madison. I'm also a neuroscientist, and you'll hear a little bit more about some of our work, hopefully, as we go through. So, thanks for having me.
Absolutely. So let's get right into it. We often hear about PTSD in adults and car accident victims and veterans, police officers, other first responders. We don't often hear about PTSD in kids, which is your area of expertise. We did hear about adult PTSD in episode 8 with Dr. Tanya Jovanovic, but get into what pediatric PTSD is, how it's diagnosed, some of the history about that.
Yeah, so PTSD in children and adolescents essentially relies on the same diagnostic criteria. If you look at the DSM, or the Psychiatry's Diagnostic and Statistical Manual, so it has these overall same categories for making a diagnosis as for adults. And what's happened over the years is that those criteria have been slightly modified or adjusted for children and adolescents. I'll say just a little bit more about that shortly. But as you probably heard from Tanya's podcast, that there are several categories of symptoms we look at. Obviously, trauma exposure is one of them, which involves an actual or threatened death, either for oneself or serious injury for oneself or a loved one or family member. And then you have these different patterns of symptoms that come along. One is the re-experiencing or intrusive thoughts of the trauma that might keep coming up as nightmares or flashbacks. Another area of symptoms we look for is called avoidance. So not wanting to be around reminders or talk about reminders of the trauma or other things that happen surrounding the trauma. And then there's this series of symptoms called negative cognitions and mood. And those can be things like detachment, not enjoying things as much as kids or adults used to, as well as really altered thoughts about the world. And these could be things like, I'm broken, or nobody loves me. We see this in abuse survivors, that they might feel guilt about what happened to them, or somehow they feel responsible for not saying something sooner. So that's this category of what we call negative cognitions and mood. And then finally, there's this hyperarousal category, which I think a lot of people may be more familiar with from knowing about veterans, for example, with PTSD. And these are things like a heightened startle response, so being really jumpy to loud noises or sudden movements of somebody coming up on you, difficulty sleeping. And in kids, certainly, we see a lot of irritability, sometimes reckless or aggressive behaviors that can come out as well. Now, to your question about how do the criteria differ in kids and how have they evolved over the years, for some time, PTSD was not even recognized in children and adolescents. It was really thought that this was an adult disorder. And of course, that is not the case and was recognized increasingly over the years. But the other thing that we've figured out as a field, I'm not saying I figured this out, but everyone in the folks and the researchers in the field have increasingly found that if you just use the adult criteria, you underdiagnose PTSD in kids. And perhaps that's not surprising. So the brain is developing, and children, even adolescents, aren't often able to verbalize all the things we just talked about. So they may not be able to say, oh, well, I'm having repeated flashbacks or thoughts of the abuse when I was 5.
Right.
Or I feel like I'm fundamentally broken and at fault for this. Particularly from younger children, you're not going to hear that from them. What you'll see are the behaviors, and this is often what parents come in telling us about. My child is so irritable, they can't sleep. The littlest things seem to set them off and into aggressive behaviors. And so that's why the criteria have actually been modified for the DSM for diagnosing PTSD, particularly in younger children, preschool especially.
Yeah, yeah. And that makes total sense, like you said, because kids aren't able to verbalize what they're feeling in the same way. So that makes your job as a child psychiatrist even more difficult. So, can you talk more about what you rely on, behavior changes? What types of things do you look for when you're diagnosing, talking to parents, other clues like that?
Yeah, parents, it's a bit of detective work, and have to be persistent with kids, and also understand that you may not arrive at that diagnosis at a first visit either. So this can take time, and oftentimes what we'll see are the behavior changes, things we talked about, like not sleeping, being irritable, aggressive, maybe hitting other kids at school. Um, and it's not, and we may ask about trauma, and the parents may not know about it, or caregivers may not know about it. And the child may not be ready to talk about that yet because of all these other feelings we talked about or thoughts we talked about. Shame, they might be afraid that that could happen again, or someone could come after them in retribution. So unfortunately, sometimes it's not until years down the road that a child is ready. And so one of the things we do as clinicians is, and I think trauma-informed teachers, educators, caregivers, coaches, all can do this, is try to create a safe space where when the time arises, when that child is ready, that they can talk to someone and be able to disclose a trauma without feeling shamed, without feeling embarrassed, and feeling supported. So that's one really critical piece I want to just say to your audience, is that you are all important in this process and in allowing and creating that space for a child or an adolescent to come forth. And it's really then, and it's not that you have to fix it all, but being that safe space is really important. And then can begin to work with mental health professionals to try to heal.
That's a really important point, that we're all involved and we can all create that safe space for a child to come forward. And that's the moment where it's so difficult for them, but it's so critical. So thanks for bringing that up. So you hit on different types of trauma, and this is something that is on everyone's mind right now with COVID. But, we just heard from Vara, who has PTSD symptoms related to a cancer diagnosis, which is not something, again, we typically think about when we're talking about PTSD. But can you talk about different types of trauma, how trauma is defined? How do you consider those different types, as a clinician and when you're treating kids and diagnosing?
Yeah, so there are many types of trauma, and the DSM has a pretty narrow definition of it. It has to involve a actual or threatened death or serious injury to oneself or another, right? So even if you just use that narrow definition, medical trauma is a real thing, right? Cancer obviously can kill and does kill, and can involve, even the treatments involve some pretty serious injury and are really taxing on the body and on the mind. We also often see in ICU settings where delirium can happen. So these are altered, almost dreamlike mental states. You can have hallucinations. Those can be very scary and traumatizing as well. So medical trauma is certainly a reality. There are many other types of traumas that we see in children and adolescents, and adults carry these as well. Maltreatment is one of the big ones for kids. This is defined as sexual or physical abuse. Those in particular are traumas. There are other aspects of maltreatment, like emotional abuse or neglect, that begin to get in a gray area that obviously are incredibly stressful and toxic for children, but the DSM wouldn't call them a trauma. So that this is sort of ongoing area of debate in the field about how all of this fits together. I will say with trauma types, if in the case of single event and time limited traumas, these would be things like car accidents, for example. The recovery tends to be much better from those. The prognosis is much better. That's assuming, of course, there are adequate supports in the family and the schools for that child to be able to recover and know that they're going to be taken care of. Mm-hmm. In cases like medical trauma, like cancer, for example, or some of the abuse situations we talked about, those can be recurring, chronic, ongoing traumas. Mm-hmm. And those are much more difficult to recover from simply because of that ongoing stress. And oftentimes those are occurring at some very sensitive developmental periods where systems in the brain are particularly vulnerable to the impacts of trauma, like the prefrontal cortex in adolescence or hippocampal memory systems in earlier to mid-childhood. We know that those are critical periods. On the other hand, the developing brain is also very plastic. It can be resilient. And so while there are vulnerable periods for trauma exposure, those are also great times, potentially great times to intervene because of all of that plasticity, that flexibility in the developing brain, which, by the way, is another reason I went into pediatric psychiatry. It's really the hope that that would make a bigger difference.
Yeah, absolutely. I couldn't agree more. And we share that in having, taking advantage of that plasticity. It really sets kids up, or we're trying to set kids up for better mental health the rest of their lives. So that's wonderful. I want to ask you about COVID because I think everyone will be interested in that topic, and also more recent topics. Unfortunately, there's a lot about bullying in the media we hear about gun violence in schools. So what do you have to say about those, unfortunately, timely topics?
Yeah, there's families, kids are under a lot of stress right now. We adults are too, generally speaking. But COVID has really, I think, put a new level of stress on youth and families. And particularly for those in marginalized communities, as you know, too, from your work, Hillary, that the families that are really taking the biggest hit during COVID are those who may not have had financial security or housing or food security, may not have internet access to begin with. Parents maybe, or caregivers may be struggling to find jobs. Or if they're frontline workers, those are unfortunately some of the families where a parent may have gotten seriously sick or died from COVID. And so the impacts really have been quite significant for kids, and particularly kids in those marginalized groups. Certainly losing a family member is tough and can be very traumatic, particularly if it's unexpected, which certainly has happened during COVID to many youth. But then all of these other stressors we talked about, loss of income or loss of housing, food, etc. All of those things compound. We talked earlier about how the social support is really critical for recovering or coping with stress. When you begin to take away those layers and begin to take away those layers for caregivers as well, the caregivers themselves don't have that buffer, that support to then be able to help their children. So those are a couple of points I would make. I think you're also, as you were hinting at, social media has really amplified a lot of this. Like any technology, it has the potential to do good. Unfortunately, I think the way it's currently designed, it's really done a lot more harm probably than good during the pandemic. Certainly, it has allowed youth to remain connected, at least in some ways, during the lockdown. So I don't want to dismiss that either. Right. And my adolescent patients will tell me that that's been crucial for them during the time.
Lifeline. Yeah,
that's right. Yeah, so you have to be careful who your audience is when you're making that pitch. With that said, there's increasing evidence that there can also be very toxic effects of social media exposure for adolescents, particularly for adolescent girls, in terms of body image, in terms of feelings of self-esteem, and even suicidality. We've seen spikes in those. And then the bullying can be another aspect that goes on over social media as well. And that's a really difficult thing for caregivers or teachers, educators, anyone to be able to help with, because we often don't know that that's going on.
Right. Yeah, I asked you so many things, and I want to dig into each of those topics, but I think it's really interesting with the bullying aspect, especially because a lot of kids, with stay-at-home orders, a lot of kids who were frequently bullied at school may have felt that relief that, okay, they don't have to go to the hallways, but there's this whole cyberbullying aspect now where it's like you can't, get released from that. So just crazy times. I do want to get back to treatments for PTSD. So could you talk about what current treatments we have for pediatric PTSD in particular and how those differ from adults?
Sure. So the treatments for PTSD in children and adolescents really revolve around psychotherapy. And at this point, unfortunately, we don't have any evidence-based medications that can help with PTSD in kids, unlike in adults where we do have some options. So the mainstay of treatment really is psychotherapy, trauma-focused psychotherapy. One of the classic forms of this is called trauma-focused CBT, or cognitive behavioral therapy. And remember, we talked earlier about these distorted thoughts, cognitions that may come up around a trauma or traumas that might be things like, it was my fault, I should have said something sooner. What trauma-focused CBT does, and there are parallels for this in adult therapies as well, is to help a child, adolescent recount their trauma narrative, and not just what happened, but what are the feelings, what are the thoughts associated with that, and begin to work through those in a detective-like way, in a very critical way, saying, okay, well, are those thoughts, feelings you're having accurate? Is there anything a good friend would say differently to you if you told them about those thoughts? And so really helping them to begin to coach themselves into reframing their trauma experience and their life narrative in a way that's more accurate, in a way that's more helpful and positive. Parents are a critical part of that, or caregivers are a critical part of that. So this is one, I think, critical area where the therapy for children and adolescents differs from adults, in that a caregiver is involved in trauma-focused CBT. And what happens there, and this is assuming it's a supportive, safe caregiver, they are also getting a lot of the what we call psychoeducation, background in how trauma affects youth, how it affects families, what normal responses are. Many of the symptoms we talked about are really the body and the brain's attempt to protect oneself or others in the family. And so framing it that way, I think, allows some compassion to and understanding for the responses that people have, rather than judging myself, or why can't I just get over this, or why can't I sleep, etc. So parents, caregivers are a critical part of this for therapy, and they get that same education, and they also get to experience and go through their child's trauma narrative with the therapist first, the therapist coaching them on how to be supportive when they eventually will go through it with their child together. And so it helps to reduce and take away the stigma or shame, particularly within that family unit, within that caregiver child dyad, to be able to then be able to talk about the trauma or traumas and hopefully move on and support each other through the process. There are other types of therapy that are also used in adults that we use in children and adolescents as well. EMDR is one of those, so eye movement desensitization and reprocessing. that's another way of accessing trauma memories and beginning to reframe them or desensitize them to take away the emotional punch, if you will, but doing so in a safe environment with some additional distraction to help with that. Prolonged exposure is another one that's used in children, adolescents in particular, but also used in adults, and shows evidence of effectiveness as well.
Mm-hmm. Yeah, so interesting in the fact that the caregiver is so important in all of these therapeutic techniques in kids. Just goes to show, again, everything you've been saying, that social network and the social support, and especially the caregiver, are so important for kids in terms of their recovery. So thanks for sharing that. You mentioned a couple times differences in brain development in kids, and how trauma during these vulnerable periods may affect the brain differently and may cause differences in how PTSD symptoms are expressed or mental health the rest of that kid's life. So can you talk about your work in neuroimaging and how trauma and PTSD look like in terms of brain development in kids, and what are some differences? What exciting things are you finding?
Yeah, I'll give you the brief version, and interested listeners, viewers can always look up some of our work. But to the brain development piece, so it's definitely an important consideration what the brain is normally doing in development, or doing on average in development. And the child's brain and adolescent's brain is developing pretty rapidly, and up until age 25 or so, it's continuing to develop. And really, we're seeing a maturation of systems involved, particularly in attentional control, cognitive control, to the point where they're increasingly able to regulate emotional systems and what we call things like the salience network. These are sort of our detection systems for things that may be relevant to us in the environment, whether they're potential threat or reward. So those systems certainly develop over time, and there are other different network properties that change too over the course of development, where we see more segregation between some of the major networks in the brain. What we're finding out, and there's still a lot of work to be done, I will say that, but some of the interesting findings that we're discovering in terms of trauma and PTSD and how that may be impacting brain development in youth are that the maturation of these emotion regulatory systems gets delayed or even derailed. And so, whereas you might see a strengthening of connections, for example, between the prefrontal cortex and the amygdala over time in non-trauma exposed youth, what we might expect is typical development, we see evidence of the opposite of that in youth who have been exposed to heavy trauma and have PTSD, where the amygdala, for example, becomes more instead of less reactive over time. And the connection, the regulatory strength of the prefrontal cortex on the amygdala becomes actually weaker with time in youth with PTSD instead of stronger with time in typically developing youth. We've also published some work more recently showing that using computational modeling, that trauma exposure appears to specifically delay the maturation of emotion circuitry in the brain, but not other brain systems like cognitive circuitry generally, or auditory or language circuitry. And so we think that this may actually be the brain's adaptive response in a way to a potentially dangerous environment, and keeping it in a maturational state or developmental stage that may be more sensitive to detecting threat. However, when we looked at correlates of resilience and vulnerability, we saw that there was still a differential development of critical areas like the prefrontal cortex, like the hippocampus that we talked about earlier. And it's how those develop specifically that seem to at least be associated with whether a child is able to recover versus going on to develop a mental illness like PTSD. Mm-hmm. So those are some of the initial findings that we're looking at. We've also have early evidence that sleep and sleep dysfunction play an important role in PTSD in youth. We've also have some early evidence that DNA itself may be altered following trauma exposure and contribute to PTSD and some of the brain differences that we've talked about. And the DNA can get altered through a process called methylation, as well as other ways. But we looked at methylation, which is a tagging of certain genes in the DNA, and that can then alter how those genes are expressed. It turns out the genes that were altered are ones that are involved in cortisol stress responses, neuroplasticity, as well as inflammation. All of these stress response systems cascading to affect how the brain works and develops.
Mm-hmm. If we were at a conference, I would dig into each of those points because so many exciting findings. And your lab is one of the only in the world that are focused on pediatric PTSD. So it's really exciting stuff here. And a lot that you brought up different approaches in terms of studying how trauma affects the brain in kids, which is a topic in and of itself. And you're also doing important work on tracking what are biomarkers of who's going to develop PTSD versus not, who's going to recover or not. So all of that is really, really exciting. And I love what you described in the beginning, too, about connections between different brain areas. And I think a lot of people don't think about the fact that brain areas talk to each other and that you're actually seeing differences in how they communicate as a result of trauma and how these different networks are, formed and how they're affected by things like trauma exposure. And again, you brought up the point that this might be adaptive. Growing up in a dangerous environment, your brain's machinery is really wired to make sure that you survive. So it does make sense in some aspect that your brain would be tuning into these cues and really helping you survive and rewiring itself to do that. So such important work. I guess trying to decide my best question for you. I have so many, but what are you most excited about, in terms of what you're working on currently or things that we can expect in the future?
Yeah, well, first of all, I'm excited about your work too. I can't wait to see your continuing work, Hillary, because you're doing incredible things in these areas as well, including looking at environmental exposures and how those may change brain development and youth mental health. So I'm really interested in and most excited about seeing, or at least beginning to see, a translation of these findings into actual interventions, into policies that will make a difference on the ground for the youth and families that we're talking about. These are all super interesting things to me as a scientist, and we get a little nerdy about these things. But the most exciting part about it is the potential to actually translate this to better outcomes for youth and families. And so some of the things that I'm particularly excited about in our lab and others are increasing efforts to begin to translate this work. So how do you do that? Well, as a starting point, we can look at how our existing therapies, like we talked about trauma-focused CBT earlier, do those change? Does therapy change the path, the course of brain development in kids in a way that can promote resilience and restore resilience to the brain? Does it do so for the parents as well, and for the parent-child interaction? So that's really one of the most exciting things to me, is looking at how do our current therapies modify this trajectory of brain development for kids? How does it modify the relationship, as well as even the physiological or brain synchrony between a caregiver and a child in a way that can become more resilient? Those are things we're actually starting to look at in some of our work. I'm also really excited about developing novel interventions. So, partly inspired by you and your work, we're trying a virtual reality based biofeedback intervention
Yes.
uh, for youth with trauma exposure and PTSD. And so this is something that, at least theoretically, should target some of the circuits we talked about, and how areas like the salience network and the prefrontal cognitive control network, how do those communicate with each other, and hopefully strengthening those connections with a biofeedback, in this case using breathing, but in a virtual reality environment that hopefully will be a lot more engaging for adolescents, as I'm sure you've seen in your studies.
Absolutely.
So these are some of the things I'm really excited about. Again, back to your work as well. How can our science also influence policy level decisions? I think is an important piece of this too. Whether it's environmental exposures or pollutants, or considering that the families who are under so much stress that we talked about, what additional supports can we give them, so that we can avoid or prevent or help kids recover from the many stresses or traumas that they might experience.
Yeah, and I love to see how we can help you with some of these messages, because you have so many great messages about, teachers being trauma informed and counselors and getting the message out and getting that appropriate training so they know how to deal with, kids who are struggling, which the reality is a lot more kids have these experiences than we think, especially now. So,
Yeah.
Kudos to you. It's all all back to you. I'm really excited to see what you do in the coming years, and we'll have to get you back in a couple years to see how much you've progressed and made a difference on this front. I'm very excited for that. I want to end with, what would you recommend as a physician for families who are, or even kids who are struggling with some of these symptoms?
Mm.
What resources can you suggest?
Yeah, that's a wonderful question to end on. I think for kids who may be struggling, just know that you're not alone. And for families who may be struggling, for that matter, parents, caregivers, or youth, you're definitely not alone. And there are resources out there for you. And one that I would recommend is the National Child Traumatic Stress Network, which is a really wonderful resource and website that has an incredible amount of information for teachers, for educators, for parents, for kids themselves. So there's a lot of information in there about what trauma looks like in youth and families, and how we can respond to that, both personally, but also, if we're someone who's trying to help a child to cope. I think talking to somebody you trust, somebody who's safe, is an important part of that too. Maybe it's a caregiver, maybe it's a teacher, maybe it's somebody in your church or mosque or synagogue that you can go to. Maybe it's a coach. It's finding that person who you can at least share some of what you're going through, and who will be able to be there for you in a safe way, is also important. And for kids who may really be in crisis, there are a number of crisis lines as well, that they can call, whether it's the National Suicide Crisis Line. The Trevor Project also has resources. So I think if we can put those in the chat or in the transcript, that would be great for families and kids.
They'll be right in the bio. And what do you suggest for parents who have noticed some of those behavior changes you mentioned earlier? Where should they start?
Yeah, for parents, caregivers, if you don't have a mental health provider for your child already, what you might consider is reaching out to their pediatrician first, if they have one. If they don't have a primary care doctor, pediatrician, you might reach out to, say, a school counselor. And they're also another good point, oftentimes for referring for other resources. Every county also has a public mental health system, so you can also look up your own county's mental health resources for youth and families.
Awesome to find someone locally. Beautiful. Well, thank you so much, Ryan. I really appreciate your time, and thanks for doing this. I look forward to seeing what you do next.
Oh, thanks, Hillary. Likewise, and would love to come back. So thanks for having me.
Awesome. Thanks. That wraps up another episode of the Brainstem podcast. Thank you so much for listening. Please subscribe and share this with friends and family, and be sure to follow us on social media at Brainstem Podcast.